In my personal opinion, I think humans are interacting with the environment and the wildlife more and more, and that exposes us to a lot of different kinds of viruses that humans cannot and will not be able to deal with. I believe that this will not be the only time in our generation that we will like see a pandemic. There might be many more to come. I guess that all nations should have a rule book of how to deal with pandemic situations.
We normally prescribe it. I would say it's a prescription that we give it to our frontline workers. We should not give a prescribed way of communicating. We should give them the tools that these are the tools that you can use.
Because we're such a diverse country, and also because we have to acknowledge the digital gap is huge, I think while WhatsApp is a beginning point for communicating about pandemic and the do's and don'ts and what the government was doing where it was using Twitter and social media effectively, I do think that another very critical point and role has been played by the community radios, which reach out to the larger public living in rural parts of the country who have no access to these digital tools. So I feel for any effective communicator, you have to first understand who your audience is and then look for those kind of tools which will suit you the most.
Engage in dialogues and conversations where you are willing to listen to your audiences, where you're willing to listen to different kinds of communities, and you start building trust not by reaching out to them when they need to hear from you, but start reaching out to them before they need to hear from you.
So we used simple games, we used simple stories like that story you must have also heard about, ki डंडे वाली स्टोरी की एकता में शक्ति है. So similarly, we have taken that analogy in our immunization, and that was brilliantly understood by the community members, and it was so fluent, and she feels so confident in communicating to the community.
So if we are going to be able to, within a story, within the telling of a story, seed in information, then it can be a very interesting tool to pass it on.
We are such diverse human creatures. We don't soak in information in just one way. Visuals are also very important for a lot of us to understand information. It could also help maybe people who cannot read that language or are not educated in that language.
As researchers and communicators, we need to diversify the medium that we use to communicate our ideas.
When the infodemic hit us, we partnered with an Iranian artist and we decided to come out with multilingual comic strips which could be easily circulated on WhatsApp, because we realized very quickly that WhatsApp was a source for a lot of misinformation. So we came up with these comic flashcards, myth busting some of the more popular myths. So, for example, sun will kill the virus. So we came up with very, very fun sort of comic strips to counter these misinformation, and they did get widely circulated.
It's very important that you're able to combine insights from multidisciplinary research, which spans across the natural sciences, the social sciences and humanities, which can also be called the science of science communication. And we can learn a lot more things in terms of how to make a communication more evidence-based.
Let us be wary that we are wrapping content in emotion, and the consequence of emotional content, the impact could be negative sometimes, like panic, like distrust of others. So let us be very wary that we ensure that health related information is conveyed with emotion, yet in a manner that the precaution aspect is understood, the resilience aspect is understood, not a sense of panic and fear.
So in public health communication, there are 4 C's that we always think of when communicating. The first is the correctness of the information that I'm communicating. If I am not sure about the correctness of the information, then I will not communicate that information.
When it comes to providing correct information, it's the health worker who provides correct information. A lot of studies have indicated, and it has guided us also, that health workers are the first one to be in touch with the community, and they provide the right information timely. So it's very important that we build their capacity so that they are able to communicate effectively and give right information to the community. How? Number one is they're from the same community. And number two is also her existence is there. She is seen as a health worker. And there is another way of communicating is also through the influential people among the community, which we have utilized vastly in our polio program as well as in immunization program. So what we do is we identify these influencers, influential people from the same community, and we build their capacity in terms of knowledge-wise.
The second C is around the clarity of the information. So we need to have very clear communication, because ambiguous communication results in confusion, which we need to absolutely avoid.
Complex scientific terms, processes, language has to be made understandable to the general public. This would also require that journalists who report on science understand science better, and that more people from scientific community do journalistic work, and that be given print space.
The third thing that needs to be is the concise information, which means that, or you can say crisp information. It's very difficult for people to retain a lot of information.
I think people who lived through COVID and lived through the news coming in at that time knew that there was just so much going on at any given point that we as communicators realized early on that our role should not just be to throw nuggets of information as people as they keep coming in. It's to process that information, find out what the most important points are, find out what the most relevant points are to our audience before disseminating any information.
And the fourth C is around the context. So every communication that is made has some kind of context. When I'm talking about polio eradication, is completely different from when I'm talking about coronavirus or COVID-19.
If you remember, in the early days of the pandemic, there was a video that went viral showing appropriate hand washing technique. The video showed two hands with gloves on and using a black ink, and how after the 20 seconds of doing it properly, the hands till wrists was covered. That was one of the best examples of science communication, showing by doing.
Allow your audience to see that you are a human being or a team of human beings that is also being shaped by the pandemic before rushing to a place of giving wisdom to somebody. Empathize with people, relate to people, and it's very easy to do that because very often communicators are also going through the exact same challenges that their audiences are going through.
So whenever you're trying to communicate any message to any kind of audience, it's very important to keep in mind the 5 elements of communication theory, which was first proposed by Harold Lasswell. So these 5 elements of communication theory are A, the sender, which is you who's sending the message; B, the receiver, which is the audience who's receiving your message; C, which is the message itself, which is the information that you want to convey to your audience; D is the medium or the channel or the platform that you're using for conveying that message; and E, the feedback or the noise in the system in terms of understanding what your audience needs and being able to communicate with them on in a two-way fashion.
Transparency,
Empathy,
Honesty and clarity.
Democracy,
Trust,
Empathetic listening,
Me and we.
Truthfulness.
To listen, simple and sateek.
I believe 2020 and 2021, as it started, is a strong reminder of what Mahatma Gandhi had to say, that change in the society begins from the self.
It's also very important to start thinking about building media literacy skills and skills like skepticism, rational thinking, critical attitudes, because we have been dealing with a lot of misinformation and disinformation during the last 1 year during the pandemic.
I think honesty is what communication needs the most right now. And if communicators are honest, I think we can build that trust back that we might have lost over the last few years.
We need experts with the knowledge, with relevance, with experience, and with proven track record to lead communication. Here we have all and sundry with huge social media following, promoting something that is unproven, dangerous. This is doing more harm than good. The pandemic has shown how important it is to invest in science communication.
Community members from the same community who are already brought in to the program through immunization program. So we have actually taken them in account and made a small group, 4 or 5 members group. It's called community action groups. Similarly, I feel we can do it very well with the youth group as well, who can actually be oriented into the current scenario and give a correct information to their peer groups.
The better world for tomorrow can be built by focusing on primary healthcare, because we have all understood that prevention is the key to having a good, healthy life. We can build a better world by focusing on the mental aspects of health, on the social aspects of health, remembering that the world is, after all, one large village where all of us are connected. And finally, by having a very clean environment, because ultimately clean air and clean environment are key to having a very healthy life.
We need to acknowledge problems of accessibility. We need to acknowledge problems of equity in the old normal for us to start building back, because otherwise it's just a running clock until the next pandemic.